Hi class, my name is Noah Southworth, and today I'm going to be presenting my psychology presentation on the topic bipolar disorder with a more in-depth about the types of effective medications used. To start, the reason on why this topic stood out to me was because my significant other is diagnosed with it, and I just wanted to learn a little bit more about this disorder so that I can just be a little bit better of support. And the reason on why you might think this is important is because this disorder is ranked 12th among the 17th leading source of disability among all diseases worldwide. Furthermore, those with this disorder have suicide rates 20 to 30 times more higher than the general population. And lastly, the longer individuals experience this disorder, the more deterioration to the prefrontal cortex, and that means they just have bad stress regulation. To tell you about the basic knowledge of this disorder, the affective disorders are classified among a spectrum from unipolar depressive disorders to bipolar disorders 1 and 2. Bipolar 1 is defined as a presence of overt manic episodes with a range of manifestations including overconfidence, grandiosity, talkativeness, extreme disinhibition, and irritability. The main difference between bipolar 1 and 2 is the fact that 1 has reoccurring manic or hypomanic episodes that have alternating depressive episodes, whereas bipolar 2 has episodes of depression but alternating with hypomania rather than mania. To speak about another disorder that is similar, that would be cyclothymic disorder. This disorder has reoccurring depressive and hypomanic states lasting for at least 2 years. However, they do not meet the threshold of major affective disorder. To talk to you about the treatment options, some of the treatment options include mood stabilizers, antidepressants, antipsychotics, CBT, psychoeducation, and family-focused therapy, as well as other medications and drugs that can be used. To specifically share what I have learned from the scientific article, I learned about the overall disorder and the following facts behind the disorder. The scientific article shared about the psychiatric and medical conditions developed through this disorder. For the psychiatric conditions, around 71% experience a anxiety disorder, 56% develop a substance abuse disorder, and then 36% develop a personality disorder. To talk to you about the medical conditions, chronic medical conditions developed. 37% develop metabolic syndrome, 35% develop migraines, and then 21% develop obesity. And then to share with you some of the medications prescribed and tested, studies have found that to treat acute mania, it is best to do it with a combination of antipsychotic agents and mood stabilizers. With children, trials have found that risperidone was more effective than lithium or divalproex sodium. Also, haloperidol and paliperidone was more effective, however, it wasn't FDA approved yet. To talk to you about the nature versus nurture piece, bipolar disorder speaks on the nature side towards genetics. This disorder can be inherited by a child given from a parent that has this disorder. It has been found that up to 90% that there is a 90% chance of a child developing this disorder if the parent has it. To speak to you about how bipolar disorder goes into nurture, bipolar disorder can be developed outside genetics. It is possible to develop this disorder through a very stressful experience, a death of a loved one, or just drug abuse. To speak about the controversy of this topic, the main controversy that I found was individuals believing that medication's side effects didn't outweigh the benefits. These costs that when taking these medications would lead to hypothyroidism, reduced renal function, akathisia, sedation, drowsiness, high risk of metabolic abnormalities, weight gain, and liver toxicity, to name a few. As for the conclusion, many individuals struggle with this disorder that inhibits them from experiencing life the way we do. These individuals struggle with waves of emotions that inhibit them from their daily lives. It makes them unmotivated. It creates feelings of suicide and deep sadness where they struggle to live their lives. One special note that I want to end on was that 1/3 of those who struggle with this disorder waited 10 years before they could be prescribed medication for this disorder. And lastly, here is my works cited page. Thank you for listening, class.